Assalamu alaikum. Now the history CKD, chronic kidney disease. The question may be known case of CKD came follow up take focus history. So the first of analysis, first of the introduction rapport formation, and then analysis of the presenting complaint. So what is your main concern? And the analysis of this, and then we will go for the constitutional. The analysis may be he may present with generalized body swelling, bony deformity, skin bruising. Okay, and after analysis, nowadays is there any? Do you have? It does. He has any kind of fever? Do you have any concern regarding his weight? So actually, in CKD, yeah, patient usually they have failure to thrive. So, do you have any kind of growth chart? So, what do you do so far for this weight? And does he under any kind of dietitian or not, and what is the intervention when you last meet with him, and now the what's about his daily activity, and now the systemic review, we can start from the urinary system. What do you have, how frequently he pass the urine, and how much fluid she has to take, and any does to complaints any kind of painful maturation, any bed waiting present or not, and then from CNS any kind of headache, fits, weakness any part of the body, and then cardiovascular system, does anyone measure his blood pressure, and what did if pressure hypertensive, so what did he take for this pressure when the pressure was last measured, any kind of palpitation, any cough, any breathing difficulty, any tummy pain, what about any nauseated, what about his poo habit, and any joint pain, any joint deformity, any skin rash present or not. And after that, do you have any concern regarding his hearing and vision? And after that, the history of the past medical illness. We will take the detailed history when he was diagnosed a case of chronic kidney disease, and what was the presentation, what was the investigation, what medication is going on, does he undertake any kind of team or not, is he regularly follow up with this, any what is the compliance of the medication, and perinatal history, and then after perinatal history, family history, developmental history, allergy history, vaccination, especially extra vaccination is taken or not. After that, family history, of consanguinity, chronic, does it looks like you or the different, and any kind of family member having kidney disease, diabetes, high pressure, and then social history is very important here. Do you need any kind of extra help, extra financial support, and then what's about his schooling, sports activity, does he can any kind of depression, is it easy access to transport, and who to contact when the child is unwell. And after this, from history we may get the cause of this CKD, and also what are the complications in this child is present. And so what investigation would you like to do? Investigation, blood investigation, CBC with full blood count with PPF, anemia of chronic disease, renal function test, increase urea creatinine, serum electrolytes normal or low sodium, increase potassium, and serum calcium normal or decrease, phosphate increase, phosphate, alkaline phosphatase increase, parathermal increase, and vitamin D3 decrease, and serum complement level, and 80 double strand DNA. Urine analysis for partial specific gravity, fixed protein, fixed specific gravity 1010, and 24-hour urinary protein, and imaging extra of the wrist, ankle joint, abdominal ultrasonography, DTPA, DINSA, nucleating history histogram, and examination, airway, breathing, circulation, vitals, and emphasis on the blood pressure, anthropometry, any dehydration present or not, and skin survey, edema present or not, per abdomen examination, urogenital examination, neurological examination, musculoskeletal examination, pallor present or not. And the management is short-term management or acute management, long-term management, avoid of dehydration, avoid of nephrotoxic drug, maintenance fluid electrolyte management, and management of hypertension AC inhibitor, management of proteinuria by AC inhibitor, and long-term management. Long-term management and multidisciplinary team, pediatrician, pediatric nephrologist, dietitian, social worker, or clinical psychologist if treated as with school. And here the prevention of the metabolic bone disease and prevention of growth and monitoring. And for monitoring and management of the growth and nutrition, regular dietary review, increased calorie intakes, enteral feeding, growth hormone therapy, correction of anemia, and correction of erythropoiesis supplementation, immunization, social and psychological support. Now, the indication for renal transplantation, when there is renal osteodystrophy, hyperkalemia, and uremia not improved with the conventional treatment, failure to thrive, hypovolemia, and delayed psychomotor development. This is the indication. And the contraindication for renal transplantation, there is adverse cardiorespiratory disease, severe sepsis, there is cancer present except the skin cancer, and when the patient's condition is so psychological condition is so much poor that he can take care of him or herself. HIV infected patient, severe or chronic hepatitis, and what after renal transplantation, what may be the complication? Infection, rejection, obstruction, bleeding, hypertension, electrolytes imbalance, dehydration. And long-term management following renal transplantation, this will by multidisciplinary team, and it will be managed by in transplant kidney, clinic, and avoidance of the nephrotoxic drug, and avoidance of life attenuated vaccine, medication to prevent the rejection, and prophylactic medication for antibiotic, and valganciclovir for cytomegalovirus. Avoid the nephrotoxic drug, and follow up with blood pressure, JVP measurement, and also creatinine versus baseline creatinine. What is the cause of the fever if the child is an innate transplanted child? Here, there may be the cause may be infection, rejection, UTI, obstructed uropathy, and if on dialysis, we have to rule out the peritonitis. Complication of CKD is complication of chronic anemia of chronic disease, failure to thrive due to nutrition, chronic disease, endocrine metabolic program, depression. Thank you.